It also breaks our hearts that we are just watching from the sidelines while our peers in the Canadian healthcare system are overworked and stressed out. We are here and we are ready to help.
In the face of a national shortage, foreign nurses in Canada are ready to pitch in, but say they're not able to.
We are here and we are ready to serve. But in order to do that, the government must help us.
Carla DeQuosin is a nurse from the Philippines living in Ontario. But even though she's passed a language test and the Ontario Nurses College requirements, she still can't work as a nurse in Canada. And that's because her work permit says she can only work as a personal caregiver.
For us to be licensed as nurses, we plead IRCC to help us with our one last requirement.
DeQuosin applied for her permanent residency in October, but is still waiting to hear back from Immigration, Refugees and Citizenship Canada. The NDP says the scale of the nursing crisis means Canada should expedite the process and hire more immigration workers to clear any backlog.
We are seeing the impacts of this shortage in communities across the country where people cannot get the care they need because there's just not enough nurses.
There aren't enough of those individuals to solve this issue, but everything that we can do will make a difference. This needs to be a multi-pronged approach to the issue.
Tim Guest is president of the Canadian Nurses Association and has been an RN for 30 years. He says this crisis has been brewing for over a decade. Canada knew when its many baby boomer nurses would retire, but there weren't enough new hires to replace them. He adds that new grads are being put under enormous pressure, with 30 to 65% of new nurses quitting within 5 years.
We're hearing stories of nurses needing to work 24-hour shifts because no one's available to come on. We wouldn't get on a plane and fly with a pilot that has worked longer than that, yet we think it's okay that we could have a nurse looking after people very vulnerable. 24 hours doesn't make any sense to me.
While health is a provincial portfolio, Guest says there's plenty the federal government could do to help, not just providing cash to the provinces. At the very least, Guest says Canada could start by tracking the total number of nursing vacancies nationwide, something that's still not done yet. In Ottawa, Xiaoli Li, City News.